24-year-old woman came for an antenatal checkup who is currently on lithium for her bipolar disorder. This drug must be stopped due to risk of the development of which of the following infection? So what do you think, guys? If the mother has taken lithium during pregnancy, the baby can land up into Ebstein anomaly. What is the shape of the heart you have in Ebstein anomaly? Kaun batayega? So very importantly, you see a box shape heart, number one. Number two, next question, why the mother has taken lithium? Who will tell me why the mother was taken lithium during pregnancy? Because lithium is a drug of choice for the bipolar disorder. If the mother has taken lithium during pregnancy, the baby can have Epstein anomaly. If the mother has taken danazol during pregnancy, if the mother has taken danazol during pregnancy, the baby can land up into virilization, important for the exam purpose, number one. Number two, if the mother has taken misoprostol during pregnancy, if the mother has taken misoprostol during pregnancy, the baby can land up into Moebius syndrome. The baby can land up into Moebius syndrome. M for misoprostol, M for Moebius syndrome. If the mother has taken erythromycin during pregnancy, if the mother has taken erythromycin during pregnancy, the baby can land up into congenital hypertrophic pyloric stenosis. Very importantly, yes, very true. So these are the important pointers must appreciate for the exam purpose. So if the mother has taken, very importantly, thalidomide, if the mother has taken thalidomide during pregnancy, the baby can land up into Phocomelia. If the mother has taken alcohol during pregnancy, if the mother has taken alcohol during pregnancy, the baby can land up into fetal alcohol syndrome. Fetal alcohol syndrome. So these are the important teratogenic drugs. An infant, which of the following milestones is achieved at the earliest? So let's very easy. So if I ask you a simple question, mature pincer grass kab aata hai? When does mature pincer grass comes? Yes, very good. So mature pincer grass, very important. Mature pincer grass basically comes by 1 year. Mature pincer grass, so basically it comes by 1 year. If the baby is holding something, if the baby is holding something with thumb and index finger, that is known as mature pincer grass. Very importantly, तनुज जो ऑप्शन मुझे लगेंगे ना रेलेवेंट है समझाने एक्सप्लेन करने के लिए, बाकी तो मैं अपने आप ही बता दूंगा, टेंशन ना लो, ठीक है. So if the mature pincer grass holding something with two finger only, that comes by 1 year. And immature pincer grass comes by 9 months, now we have something known as radial grass and ulnar grass. जब भी बच्चा कुछ उठाता है ना, if you look at the camera, if this is something is there, if baby is holding something, first he will hold by the ulnar grass, and then he will hold by the radial grass. First the baby 6-month-old baby वो ulnar aspect से कोई चीज उठाएगा, and 8-month-old baby radial grass he will have. So this is very important, the one which is earliest to achieve. Remember, very importantly, 6 महीने का बच्चा ulnar aspect से उठाता है और 8 महीने का बच्चा radial aspect से उठाता है. Please remember. Yes, very good. So 6-month-old baby will have a ulnar grasp, 8 months old baby will have a radial grasp, 9 months old baby will have a immature palmar grasp, and whereas 1-year-old baby will have a mature pincer grasp. The following image is one of the most common cause for stridor in children. Yes, कोई कुत्ता भी बता देगा. Oscar, which is the most common cause of stridor in pediatric age group? Oscar is like, I don't answer such silly questions. Please ask middle class questions. So very importantly, the most commonest cause of stridor, very importantly, that is laryngomalacia. And which epiglottis you see in laryngomalacia? So where do you see omega shape epiglottis? The answer is laryngomalacia. Please remember that, number one. Number two, very importantly, I have a baby who has distress, which improves on crying. I have a baby who has a distress which improves on crying. If the distress improves on crying, we are talking about choanal atresia. Very, very important. I have a baby who has a distress. Which increases on supine position and relieves on prone position. ऐसा कौन सा बच्चा है कि distress increases on supine position and relieves on prone position? The answer is laryngomalacia. Laryngomalacia. I'll just have water, 1 second. Yes, cheers. So these are the important points must appreciate for the exam purpose. the first primary tooth to appear in a baby, which is the first अमिताभ बच्चन कह रहे पानी था, दूध पी रहा था मैं, दूध. The first temporary teeth to appear in a baby. The first temporary teeth to appear in a baby is a lower central incisor, which comes by 6 to 7 months. Which comes by 6 to 7 months. Which is the which is the first permanent teeth to appear in a baby? Yes, the first permanent teeth to appear in a baby is the first molar, which comes by 6 to 7 years. The first permanent teeth to appear in a baby is what is important is first molar, which comes by 6 to 7 years. Which is the last permanent teeth to appear in a baby? The last permanent teeth to appear in a baby is the third molar, which comes after 18 years. The last permanent teeth to appear in a baby is the third molar, which comes after 18 years. And which is the last temporary teeth to appear in a baby? The last temporary teeth to appear in a baby is the second molar, which comes after 18 months, which comes after 18 months. So these are the very, very important questions for the exam purpose. And how do you, so what is the normal human dental formula? Any idea? In adult, what is the normal human dental formula? So it is 2123 by 2123 is the normal human dental formula. We have to clear the exam. Okay, life is beautiful. By 8 o'clock, it is a 2 to 3 hour session. Very beautifully, we'll cover all the 5 years PYQ. Try to revise, and finish it off. Identify the condition as shown below in the X-ray radiograph. So we all know that kind of intestinal contents have gone out over here. There's a beautiful picture of congenital diaphragmatic hernia. Question number 1: diaphragm is supplied by which nerve? कौन बताएगा? Yes, diaphragm is supplied by phrenic nerve. What is the root value of phrenic nerve? कौन बताएगा? The root value is C3, C4 and C5 is very important. Number 1. Number 2, so congenital diaphragmatic hernia. Congenital means by birth, and diaphragm, this is a diaphragm. Hernia. So hernia means, very importantly, all the intestinal contents have gone out. Now exam entrance question number 1: which is the most commonest type of congenital diaphragmatic hernia? MCQ. It is the posterolateral type. It is the posterolateral type, which is known as Bochdalek hernia, which is known as Bochdalek hernia. The most commonest type of congenital diaphragmatic hernia is Bochdalek hernia. Number 1. So सारा का सारा अगर intestine ऊपर चला जाएगा, when all the intestine will go up into the chest, what will happen to the abdomen? Very importantly, what will happen to the abdomen? Please remember, the patient will have scaphoid abdomen. The patient will have scaphoid, मतलब पिचक जाएगा, क्योंकि सारा का सारा intestine, all the intestine have gone up. That is why the abdomen has become shrunken, known as scaphoid abdomen. So scaphoid abdomen, baby having distress, and very importantly, अगर auscultate करोगे तो क्या मिलेगा? कौन बताएगा? If you auscultate, you will have bubble sound in the chest. You will have bubble sound in the chest. So bubble sound in the chest, scaphoid shaped abdomen, all these important pointers are, and the most commonest type of congenital diaphragmatic hernia is Bochdalek hernia. Yes, Pranay has told a very beautiful point. What is the, okay, we talk about bag and mask ventilation. So bag and mask ventilation, very importantly, kaun batayega? Which is the absolute indication and which is the absolute contraindication of bag and mask ventilation? So we all know that hum bag and mask kab haath lagayenge? Yes, life is beautiful. Yes, life is so beautiful. So when the heart rate is less than 100, the absolute contraindication of bag and mask ventilation is heart rate less than 100. And what is the absolute contraindication of bag and mask ventilation? The answer is congenital diaphragmatic hernia. So if a baby has a heart rate less than 100 with congenital diaphragmatic hernia, तो आपने तो बोला कि don't do bag and mask. अभी क्या करना चाहिए फिर? So now, of course, in congenital diaphragmatic hernia, you will not do bag and mask. What we will do, you will intubate and ventilate. You will intubate and ventilate. That is important if you do heart rate less than 100 with congenital diaphragmatic hernia. Every single second counts. Life is amazing. We're gonna have a cerebellum party. with drinks, as in vegetarian drinks, not non-vegetarian drinks, and a lot of selfies, lot of meeting. Dr. Zainab, everyone will be there. Please finish this exam, crack this exam. We're gonna have a very, very big party in a very five-star hotel. So it's gonna be amazing. And we're gonna meet, that day you will come and hug me. Anand sir, you were there and I can meet you now. So 200 plus, we can do it. It's not that bad also. I swear to God. Please finish it off. Revise, 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 and finish. 5-year-old child is brought to you with complaints of 18 episodes of loose stools in the last 24 hours. So 18 episodes सुन के पहले आएगा चक्कर. 18 episodes. Oh my God, looks like a severe dehydration. And he's vomiting twice in the last 4 hours. The child is irritable but drinking fluids. But if he is drinking fluids, so obviously he is into some dehydration. Very importantly, like you can say no, mild to moderate, or no to some dehydration. And in this case, what will you do? Of course, ORS, ORS, ORS. I would have given IV fluids, if the child was not at all drinking. Yeah, plain water and ad libitum. No, no, no. ORS, 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 ORS is the best answer. Yes, Rohit Sharma, very good. Someone has told pink category. Pink कब देंगे? जिसने pink बोला है अपने आप में बहुत गंदी सी गाली दें. Because we have diarrhea with no dehydration, diarrhea with some dehydration, and diarrhea with severe dehydration. So severe dehydration comes under pink category. Some dehydration comes under yellow category, and no dehydration comes under any idea. So we have the green category. So this patient comes, looks like he's drinking the fluids and all that, looks like some dehydration to me. So ORS is the best answer for this question. Now, very importantly, ORS. So here also ORS and zinc. Here also it is ORS at the rate of 75 ml per kg. But I have a doubt. My doubt is how much is sodium in ORS? कौन बताएगा? How libitum is nothing. वैसे बकवास है. How much is sodium in ORS? Any idea? So very importantly, yes, you are right. Sodium is 75. Do we have something else also 75? Any idea? Glucose. Glucose is 75. So 75, 75, and 65. What is 65? Chloride. Chloride is 65. If chloride is 65, what is 20? 20 is potassium, and what is 10? Citrate. Citrate is 10. So this is very important. Sodium 75, glucose 75, chloride 65, potassium 20, and citrate is 10. Yes, Dr. Avinash, very good. कि ये पूरे पैकेट का osmolarity कितना होता है? The whole packet osmolarity is 245 milliosmoles per liter. 245 milliosmoles per liter. If this is ORS, then what is Risomal? Have you heard of Risomal? Risomal is rehydration solution for the malnourished. Sam बच्चों का packet, ORS packet, that is Risomal. Normally the ORS packet, no, you take 1 liter bottle of water and you add 1 packet of ORS. But here you have 2-liter bottle of water and you add 1 packet of ORS. Water will be double. 1 liter of water and 1 packet of ORS, that is ORS. And in Risomol, you have 2-liter bottle of water and 1 packet of ORS. So potassium kitna hota hai? Who will tell how much is potassium in the Risomol? So very importantly, yes, please remember, potassium will be double, that is 40, and sodium will be half. So sodium will be 45, potassium will be 40. Normal ORS potassium is 20, here it is 40. Normal sodium is 75, and here it is 45. So yes, very importantly, you can do it. Do you think you have the guts to do it? What do you think, guys? Do you think you have the balls to clear an exam? Do you think it's that difficult? I don't think so. We can do it. हो जाएगा.